We just talk about what we are doing with malaria, which is for us a big campaign. Malaria is responsible for the largest mortality in Nigeria. If you take children and adults together, it kills more children than any other disease, and it kills more pregnant women than any other disease. I mean, that's for sure. We think that, and we believe that if we do what we have to do, we can cut mortality by the end of 2010, early 2011 by 50%. And we've started. Now, what we propose to do is to distribute 2 nets per household in Nigeria. 2 nets per household. We're going to have access to in excess of 60 million nets, which we'll be distributing on the basis of states. We started in Kano, we're doing Anambra, and then we're going to move to the rest of the states. The reason why we have to stagger it is the issue of production, how we can get the net to get here in good time, because there's also a demand on nets worldwide, and so where we're getting it from, we're not going to get all that we need at the same time, and so we have to stagger the distribution. Now, we're not just doing nets, we're also complementing it with providing free treatment in public spaces, in public health facilities for malaria. For those of you who have had to buy the combined treatment for malaria, you know it's very expensive, but we're not going to provide it for free in public outlets. And I think that will reduce the level of parasites in the community, and also when you take it with this, it's a winner. Now, in addition, we're also going to be doing indoor residual spraying. So we'll come here and spray this room and do it, say, about 4 times in the year, and that would reduce the parasite, the mosquito density, especially in the areas of Nigeria where, you know, this is a big problem. And I think that integrated approach is what we propose to do, and we believe that if we do it conscientiously, we can actually reduce malaria, the prevalence and the mortality and morbidity from it by more than 50% in 2 years. Fortunately for us, we have resources. We applied for a Global Fund grant, which has been approved. We also have money in our budget, and we also have money from the World Bank to do this. So that's going to be a major push in the next year or two. This would evolve, and I think that we would like to have you partner with us on that. It will involve having to have Nigeria know about this. You know, we've had experiences where nets have been distributed and they've not been used. We've had experiences where nets have been distributed and people have used it for fishing. We've had experiences where nets have been distributed, they've used it for their wedding gown. I mean, those sorts of things. So we need to begin to talk to Nigerians in a systematic way so that they will understand the value of this net and provide in public facilities, ACTs for those who actually have fevers. And what we're going to do in those public facilities, because one of the problems that I find in practice is that everybody that has a fever has malaria. That's not true. We are going to encourage now to have parasite diagnosis, so they would actually go and be tested, and so you are treating the appropriate things. And as I said, we have resources to do that in public facilities and for pregnant women and under 5s. Where my coordinator is currently in Tanzania, we're working out a system where we can also subsidize what the private clinics are going to do, so they can also offer treatment for malaria for cheap or almost for free. So when we cover treatment and we cover the nets and we cover indoor residual spraying and public education, I think we would have done what we need to do for malaria. And I think that there is a sustainability thing which we are working into it. Nets are going to be, we're going to start producing nets in Nigeria in August. 2 companies will start. So then we're also working with IFC to assist our drug companies to attain GMP status to produce the drugs, so that we, for security, we will have our own nets and we'll have our own drugs. And once we do that, of course, the cost comes down considerably, and then we'll be able to sustain it.